actually we can achieve a strategy just to come up with the BDCA, like Edward Deming, just write the goal and how we can improve it, like some objectives, actions, responsibility, indicators, and so on and so forth. Or we can go like the Japanese. The Japanese people, when we go thinking about how they can improve and how to create strategy. So the idea starts at the beginning from the leadership. Then the leadership deploy it to the frontliner, like the business unit. As I said, I'm going to think about like we have a problem with the outcome. So we have a problem with the patient safety. So how we can improve patient safety? So they take this, the North Star, the patient safety that we would like to go for, and we deploy it to every single department. So we give it to the nursing and said, we would like to improve the patient safety at the nursing. So how can we improve it? So nurses will come and say, okay, we have a problem with the patient identification. We have a good number of wrong patient management. We're going to focus on the patient identification. And again, we have a problem with wrong medication administration. So we can focus on the right process of our safe medication administration process. Again, we have noticed that a good number of the patient come up with surgical site infection and hospital-acquired infection. So we're going to focus on the implementation of the infection prevention control, especially during dressing or during doing a procedure to the patient. So that's what we are going to do as nurses. And then we deploy the same North Star to the pharmacy and said, now, your pharmacy staff, tell us how you can improve the patient safety from your perspective. So they're going to look at this, okay, if we are focusing on patient safety, we can look on how the safe process of medication dispensation, and we can focus on how to avoid the patient allergy and the drug-drug interaction, and how to ensure that we provide the medication that's not expired, and how to avoid mistakes with look-alike and sound-alike. And also because we do have a clinical pharmacist in the hospital or in the setting, so the clinical pharmacist is going to review every single prescription or management plan that's prescribed to the patient. So this is how the pharmacy. So what happens? The top management identify the major problem and deploy it to every single business unit. And every single business unit come up with the idea themselves. And then, okay, so we're going to ask the business units, okay, so if those what you are going to focus on, which are objective, those are objective, by the way, with Deming, those are objectives. So what are the actions that you're going to do? So what are, so those are the objectives. So what are the actions? So they're going to tell us the action they are going to follow. And they're going to say by the end of the day, so we're going to give this responsibility to X and Z. And we are going to measure this every month by looking into, for example, nurses are going to look into the number of the wrong medication administration, the number of, for example, the wrong patient management. So this is like an outcome indicators. And then we are going to make sure that we're going to do all of this activity within the next 3 months or 4 months. This is the timeline. So by going with the Hoshin Kanri strategy, like building the Hoshin Kanri strategy, it's going to be simple and easy. We start from the top, knowing the North Star, come up with goals like improve the patient safety, deploy it to the business units, so nursing, pharmacists, and the others, come up with objectives like focus on safe medication administration, focusing on patient identification, focusing on prevention of the surgical site infection, come up with the objectives, which like very short-term objectives, start the implementation of the actions, measure it monthly, come up with the result. Are they good activities or not? This is how we can have it. And finally, by the end of the year, we come up with the annual report. If we implement the Hoshin Kanri strategy, it's going to be simple and easy. And remember, what we are doing at the moment is not like a 4 or 5 group creating their own plan for the whole hospital. No, we give it to the hospital to create the plan. And we give it to the business unit to be accountable and responsible for whatever they're going to write down. What we have done at the management level, leadership level, we just give them our North Star, which is the strategic goals. That's it, no more, no less. I will share with you a video that will tell us how to implement the Hoshin Kanri strategy. And like this is a Japanese technique that's used by a German technology company like Siemens. So please watch, learn how we can do the Hoshin Kanri strategy.
All set for the digital transition and new market conditions with the business-proven methods of the Siemens Development System, or SDS for short. SDS is helping Siemens become an innovation leader and a digital champion. Nora has been working for Siemens for a long time. As every year, the targets need to be set soon. But Nora doesn't really know what her personal goals have to do with the overall vision of the company. That is exactly what her team lead, Theo, and the top management want to change through Hoshin Kanri. Nora has never heard of Hoshin Kanri. Theo explains it's a company-wide planning method that involves all employees and managers. The term comes from Japanese and means compass needle management. Let's take a look at what Hoshin Kanri can change. First, the top management team agrees on a common North Star. They formulate a future state as their long-term vision, pointing the organization in the right direction. They also define a mission as the organization's purpose. Next, medium-term targets that support vision and mission are defined. These are called breakthrough targets. The top management and experts from the organization decide on them together. Breakthrough targets describe what the situation should be like in 3 years. They answer 3 questions. Why do we need to reach that target state? What should the result be? Whereby can we tell if the target state is reached? Still, 3 years is a long period of time. To make the goals more tangible for the employees, representatives of all functions define short-term targets, future states for the end of the next year. Everybody decides what they will contribute to these future states. In order to achieve an alignment, every participant presents his contribution to the group to get feedback. All contributions result in a consistent picture. But wait a minute, we have more than one group. Therefore, the representatives go back to their functional teams and align all contributions. If a contribution cannot be delivered, they describe why this is the case. Together with the committed contributions, the statement is then given to the upper level. That way, the management team can help anytime. During the year, the teams work on reaching the future states and check regularly if they are on track. If not, prompt feedback is given to the management to get help. After 1 year, the whole group meets again to review on what they have achieved concerning their short-term targets. They check if they have come closer to the breakthrough targets or if they have to adjust them. Then the cycle starts again, and they define new short-term targets. Now Nora knows this is Hoshin Kanri, a method that gives Siemens a clear path to a common target.